Thank you, Dr. Sadiq, for such a detailed introduction. I would like to talk about today about the DEXA-derived indices in sarcopenia evaluation, because we know sarcopenia affects the older individuals more than the young individuals. But we can see in our society, the young children, because of the diet, they are also being affected by sarcopenia. So this presentation focuses on the critical role of DEXA-derived indices in diagnosing and evaluating sarcopenia. We'll explore the various metrics derived from DEXA and their implications for clinical practice and research. Our overview is, what is sarcopenia? So sarcopenia is defined as the progressive loss of skeletal muscle mass and strength both, primarily due to aging, because it's the first and foremost cause of sarcopenia is aging. It significantly impacts physical function and quality of life, and making early identification crucial for effective intervention. Why muscle mass assessment matters? Assessing muscle mass is vital as it aids in early detection of sarcopenia, allowing for timely interventions. Muscle assessments helps to quantify disease severity and monitor the efficacy of treatments, ultimately reducing the risk of falls and fractures in older individuals. How DEXA can help in determining the muscle loss? Dual energy X-ray absorbometry is a reliable and is the gold standard for evaluating the muscle mass and in the process of body composition, which is we term as particularly the lean mass assessment. It uses two X-rays beam. We know it already. It has the low energy and a bit higher energy from 100 and 140 keV. We know that the muscle mass is a bit dense, so absorption is like different from the lean mass as compared to the fat mass. So the diagnostic, we will talking about the diagnostic indices that we derive from the DEXA. The most important index is the skeletal muscle mass index, and ALM, which is appendicular lean mass to the ratio of BMI. These are taken to be as the gold standards for assessing sarcopenia. The future directions for the sarcopenia assessment is the use of AI. We know that AI has incorporated each and every field. When we utilize AI, it can help in determining the compartmental analysis of muscle mass. So understanding sarcopenia is we determine the skeletal muscle mass as well as the strength. Only the muscle mass evaluation is not termed as sarcopenia. We need to see the strength as well, which involves the hand grip and as well as the gait speed. The gait speed taken to be as 0.8 is taken to be as normal. Lower than that, meter per second is known as low gait speed. And if the gait speed is low, and with the result of decrease and also the low muscle mass, we can term the patient as sarcopenic. The global impact is immense of sarcopenia. About 20 to 40% of the adults aged greater than 60 are affected by sarcopenia throughout the world. It increases about 2 to 3 times risk of mortality, and billions are being spent to treat sarcopenia annually and increasing the prevalence throughout the world. So we will shortly touch about the causes of sarcopenia. We know that aging is one of the prime or the foremost cause of sarcopenia. It's because of the hormonal decline in males, especially the decrease in the testosterone levels, as well as the growth hormone, leading to the decrease in the muscle mass. Inactivity and immobilization during illnesses or hospitalization lead to muscle atrophy. Lack of movement accelerates the loss of both muscle mass and strength, making it crucial to maintain activity levels, especially in the old. Malnutrition and low protein intake. In the young, we know that the children are not very oriented to the healthy foods. They are not taking meat properly, so they are not building up the muscles. In old age, we know that because of inactivity, lack of nutrition, malnutrition can lead to diminished muscle mass and strength, leading to sarcopenia. Chronic diseases, among which diabetes, chronic kidney disease, and cancer, they are also contributing towards the development of sarcopenia because of hormonal and inflammation causes. Inflammation and oxidative stress are also one of the contributors of sarcopenia because of the production of TNF-alpha and interleukin-6. They can promote cell apoptosis, muscle cell apoptosis, leading to reduction in muscle mass over time. So the sarcopenic individuals, how do they present? They present with muscle weakness, slow gait speed, fatigue, difficulty in climbing stairs, and unintentional weight loss. So why we assess muscle mass? Because of the early detection prevents disability. It is crucial to determine the muscle mass first, and later on it will be, if it's left undetected, may lead to decreased in the muscle strength also. So it quantifies disease severity, and after determining the sarcopenia and giving interventions, we can determine the muscle mass quantity. Monitor response to interventions, as already I told, that like pharmacological, exercise-based, and nutritional interventions can be determined by using or determining these DEXA-derived indices. So it enables risk stratification for falls and fracture. We know that if sarcopenic individual is unable to stand and walk properly, so can lead to brittle bones and fracture later on. So DEXA in the body composition, how does it work? There are two beams, that is already I told earlier, that there are two beams and they have different absorption in the muscle as well as in the fat. This is the image we can get after undergoing the whole body DEXA scan, and there is difference in the values by determining the lean muscle mass and the fat muscle mass. And the fat mass, sorry. So it calculates the appendicular and the total lean mass. What is the appendicular skeletal mass? It is the sum of the masses which are taken from the upper limbs and the lower limbs combined together. But it is not very well depicted because of the decreased in the BMI, because of the difference in the BMI. So they thought that only measuring the appendicular skeletal mass is not enough. So they shifted it to index, which is skeletal mass index by the appendicular skeletal mass divided by the height squared. It is taken to be as the gold standard, and it is taken as the standard to be compared with other modalities. It is given by the European guidelines for sarcopenia. To diagnose the sarcopenia, they take the muscle mass as well as the muscle strength, which involves the gait speed and as well as the other parameter related to the muscle strength. So appendicular lean mass and the BMI ratio is taken by the Foundation of National Institute of Health. They have also divided into different parameters by assess the sarcopenia by calculating the ratio of appendicular lean mass to body mass index, which is BMI. They also taken the percentage of lean mass, which is called the percentage ALM, is calculated by using ASM divided by the total body mass into 100. So they take over the change caused by the body habitus. So these parameters were introduced to have standardization. So lower limb lean mass by weight is LLM by weight, is also one of the criteria. It determines the muscle mass of the appendices. So that because the locomotion is dependent on the movement of the lower limbs, so they determine the muscle mass there. So there were reference values put for the DEXA-derived indices. This is by the European Working Group of Sarcopenia for the patients. They take, it was given in 2010 that the value less than 7.26 is termed as sarcopenic, and the European, in 2010, they modified, for females, it is 5.45, and they modified in a consensus 2 and reduce it to less than 7, and for women, they reduce it to 5.5. So an FNIH reduce the, if they get the value of less than 0.786, the term is sarcopenic, and for women it is 0.512. So according to the Asian Working Group of Sarcopenia, they cut off the value for men is 7, because in the Asian men have less habitus as compared to the European, so they have reduced it to 7, and for females they have reduced it to less than 5.4. So there are 3 main categories. We define them for the diagnostic purpose. They are probable sarcopenia, characterized by decreased muscle strength, indicating the potential onset of sarcopenia. Early identification is crucial for implementing preventive strategies at this point. And there is confirmed sarcopenia. It involves the dual criteria of low muscle strength and low muscle mass, confirming the presence of sarcopenia. This stage emphasizes the need for targeted interventions like amino acids, like protein intake, physical exercise, and everything. And there is severe sarcopenia, is an advanced stage of sarcopenia characterized by significant reduction in muscle mass, strength, and overall performance. So this is a wrap up of the sarcopenia. We have the risk factors, we have a list of risk factors and the biomarkers responsible for sarcopenia, and there are future directions as well that we should undertake multiple studies related to sarcopenia, and therapeutic development should be done and monitored by DEXA-derived indices. You can see the consequences of sarcopenia as well, leading to mortality. This is how I end my lecture. Thank you. Presentation. Thank you very much.